Welcome to the Sober Nation FM podcast, where we're putting recovery on the map. I'm your host, Jonathan Sylvester. This show is brought to you by Sobriety Engine. Do you want to take your recovery to the next level? Do you want more support, community, and fellowship? Sobriety Engine is an incredible free online community of men and women supporting each other in their recovery. You can get a ton of great tips, resources, and guidance to help you succeed in recovery and in life. Visit sobrietyengine.com to join today. Sober Nation FM is also brought to you by Recover Health. If you're ready to get fit and start living a healthier lifestyle, all while supporting your sobriety, then you can learn more about having me as your own personal fitness and nutrition coach at rcvrhealth.com. And whether you're listening to the show on Spotify, Apple Podcasts, or watching on YouTube, please share this with your friends. Follow, subscribe, and leave a review. Nation, let's hop right into today's episode. Today, I'll be speaking with Dr. Daniel Hochman. Thanks for coming on the show, Daniel.
Thanks for having me.
Absolutely. Now, one of the main goals of this show is really to help our audience as much as possible in their recovery journey. So I think it makes a lot of sense to have on experts like yourself who work with addicts every single day to really learn more about the different methods to get sober, stay sober, and really live a successful life. I'd like to start off by hearing about how you got into the field of addiction. What was it that really interested you and drew you towards this?
I love treating people in the addiction space and just the topic at large because to me, addiction captures really a lot of what it is just to be in this journey of life where we have constant temptations, and lures, right? To be, to shortcut happiness, to distract ourselves from difficult things, and to go for things that just feel immediately satisfying. It captures a lot of the push and pull in life around, stopping ourselves from doing those things, being able to, have the tolerance, the testament to do those things. So it captures just so much of the human experience that it's always fascinated me. I've, of course, like most anyone, had some, very close family, friends, from early on, affected by it heavily. So, there's been a lot of very close family that I have not gotten to have relationships with, for it, and knew that early on. And then the same thing, happened with friends. And so, by the time then I became a psychiatrist, I thought, well, I actually now have a background and I'm better equipped to understand and treat this stuff. So, so it sort of unfolded, from there. I won't go through, all the list of things I've done career-wise necessarily, but that's sort of how it began. I was just always fascinated with human behavior, and addiction is just right at the heart of a lot of what we struggle with and what motivates us as people.
Yeah, that makes sense. I like how you said a kind of a shortcut to happiness. I think that makes a lot of sense for me. Now, how would you actually define addiction?
I define it really as a trained pattern where we've learned to escape life's difficult problems and feelings. So it's really a way of just expressing an intolerance for an emotional state.
Okay.
So I view it, near entirely, as some escape from intolerable emotion. The emotion could be, full-on depression or anxiety, panic attacks, but it might just also be boredom, being angry, upset with things, stuff like that. So, so it could be, severe mental illness, and it could just be very subtle sorts of things as well, but just an intolerance for that state.
Yeah. Okay. That makes a lot of sense. And that's broad enough in my mind that, there's this debate a lot of the times I think about like this, that can't be an addiction or that can't be an addiction, or no, it's stupid to say that's an addiction. But I think what you're suggesting in my mind is it, almost anything that I'm reaching out to habitually to escape whatever feeling this is can be considered an addiction to a degree.
Yeah, I think that's fair to say, right? I mean, and so it's very clear, right? If you're, injecting heroin in yourself, like, and it's very regular. Okay, of course that's addiction. And then we've got the middle grounds, if you're drinking, a little too much, or you're addicted, or just trying to enjoy the evening. And then, you get further and further down that spectrum to where, well, when you're eating chocolates, and you're eating chocolate every day, is that an addiction? And you do see then, different camps, right? Some people are actually offended, that people call certain things addiction, and because it's almost to sort of try to put all these different addictions on equal playing fields or something. That's sometimes where people come from. It's like, no, that's not a real addiction. No, this is a real addiction. The thing that could kill you.
Right.
The thing that I can overdose on in a moment's notice. That's addiction. But yeah, I think it does distract us from what's actually happening inside the mind, emotionally, psychologically. So I think it's important to have a looser, broader definition. And yeah, then if we're talking about clinically what we call addiction, that can be a little bit different story. We're not going to clinically diagnose a chocolate addiction. That should not be in the diagnostic manual of psychiatry. So I'm all for having some guidelines that do cut some things off there. But as far as lay people trying to understand themselves and gain better control of themselves, it's not necessarily helpful to tell them no, that's not an addiction process at all. So yeah, we have to be tending to what's actually going on psychologically.
Got it. Now, I want to dive in real quick to that gray area that you were just discussing. Our audience, I think, is pretty broad. We have people that are kind of in that gray area, trying to figure out, like, is this an addiction issue? Like, maybe they face some consequences. We have people that are new in recovery, people that have been in recovery and sober for years, people that maybe have kind of been in and out of recovery. So for someone that might be listening or watching this that is falling into that gray area, what are maybe, like, if they were coming to you, and I do want to ask you more about your practice here in a moment, and specifically what it is and what you do. But if someone were to come to you, what are maybe some questions you would ask them or have them ask themselves to kind of help determine, like, okay, is this a real addiction or a real problem? Or, have you maybe just had some, I don't want to play this off, but some bad luck, and you just went a little far a couple times?
Yeah. So I actually am not very concerned at all, in my own practice or just in general, as far as what I'd recommend, for how people should think about it. I am not that concerned about whether it's called an addiction or not.
Okay.
If you have problematic use, if it's creating problems for you, then that's bad, and you should do something to try and help it, right?
That's fair. Yeah.
And so, whether you end up calling that an addiction or, dependence, abuse, whether you call it that or not, doesn't actually change what's actually happening, right? I mean, we're talking about actually, the semantics of labeling something that's actually already either happening or not, right?
Yeah.
So let's say I have 5 drinks an evening. Let's just, let's pick maybe or 4 drinks. We can pick some gray area. I don't care the number.
Right.
So I'm having 4 drinks a night, and we're wondering, well, is this addiction or not? Am I just kicking back at the end of every evening? Well, whether I call it addiction or not doesn't change that I am drinking 4 drinks a night. So whether or not that's a problem is something that is regardless of what we call it, right? Now, what I would do in my own practice is try to, determine and explore with the patient, when you drink in the evening, what's that about? What's going on? Are you escaping life's problems, or are you just relaxing? It's usually hard, to make a case that you're just relaxing every single evening, with 4 drinks. But anyway, that's the sort of thing you'd want to explore. So I'm always much more particular, actually, than just trying to label things, addiction. And for that matter, I also don't care so much whether I call something, major depressive disorder with a patient either, just to kind of reveal my philosophy on, diagnoses.
Mm.
If you're sad a lot, you may or may not have all the criteria for depression, right? Where you usually need like 5 criteria over 2 weeks plus time.
Okay.
Well, some people will deny a lot of those symptoms, and that actually might be a worse case of depression, right? Some people with addictions have a lot of problems, but they're all concentrated in 1 or 2 criteria and not the other ones. And so you don't have enough criteria to meet, a dependence diagnosis. So there's obviously technical problems in diagnoses. And I like to remind people, diagnoses are really only helpful in limited circumstances. Most of the time, diagnoses are developed for research purposes. So we want to know, okay, what percent of the population has alcohol dependence? What percent has other drug dependence? And what are the relapse rates? We want to know how many of them are seeking treatment, how many of them are white, Black, how many are urban, rural. We need criteria to measure all those things. So if you don't have criteria, how in the hell are you going to know prevalence or incidence of anything? You're never going to find out if you don't just choose a darn criteria, whether it's perfect or not. So I'm all for diagnostic criteria for certain reasons. If we're going to study, if a medication works or not, we have to know in our studies, who are we including in there? We want to know we consistently included the same kinds of people diagnosed with certain kinds of conditions. So diagnoses serve really good purposes, but as far as when you're sitting down doing therapy with someone, it doesn't really matter at all, actually.
Mm-hmm, mm-hmm. Yeah. Okay. Got it. That makes sense to me. I think that because to spell it out in plain English, I mean, I think what you're saying is a lot of the times is that a doctor or professional is speaking with someone and they're kind of checking off boxes, so to speak. And I may not fit into all those boxes, but that shouldn't kind of dismiss the fact that I'm feeling the way I'm feeling or experiencing what I'm experiencing.
Right. And it goes either way, right? I mean, let's just draw up some scenarios. I mean, let's say, someone totally, blacks out, binges, terribly a few times a year.
Okay.
But a few times a year, it's really bad. Maybe, it's so bad that they lose a job, get into car accidents, fall out of relationships, whatever. Okay. That might not meet criteria, for alcohol dependence, because it's just doesn't have the consistency,
the frequency
and the regularity. It doesn't meet time period sorts of things. So, so you're not going to get diagnosed, but clearly you've got, something that comes up every once in a while and rears its head. Whether we call that addiction or not, right? You could then fool yourself and say, okay, well, doc said I didn't meet criteria. I'm not an alcoholic. So then, what happens is then, you dismiss the idea that there's a problem and you're less inclined to do something about it because you had some authoritative, figure tell you, no, you don't have this thing. You don't have this addiction problem. And then it happens, in the other direction too. You get people who are then sort of overly identify as an addict when, they just barely meet a criteria. And so it can go wrong in both directions. And that's why, I mean, you always want to know, what's actually going on. And while I'm not necessarily, all about diagnoses and checklists, what I am for is being incredibly specific about how one struggles. So say this person, relapses, or not even call it relapse, just drinks very heavily and blacks out, 3-5 times a year.
Okay.
Well, they're not addicted. Okay, fine. But what am I for? I would want to describe with that person, exactly how they struggle. So is it that they struggle with certain triggers? So is it when there's a breakup? Is it when there's, the ex comes back in the life? Is it when someone reminds them of any incompetencies? Is it when their projects don't get respected? Is it, it could be all sorts of things, right? I mean, the list goes on.
Right.
Now, okay, not only that, okay, it's when your ex talks to you again, Well, but why can't you tolerate that feeling? Or why can't you get over it? Okay, well, then we're learning that you have a hard time getting over things. Okay, well, why do you have a hard time getting over things, right? So
Got it.
giving you examples for, well, we're nailing down more and more specifically what is your actual struggle. What is it that you have to overcome? And so that's the specificity that I always like to help people determine and explore. Because when you discover that, then you actually know what on earth you're even fighting.
Okay. Yeah, that makes a lot of sense to me. That makes a lot of sense. Now, your program is called Self Recovery.
Mhm.
And so, can you describe to us what that is and just exactly how it works?
Yeah, so the program is designed to help people explore themselves in ways that they generally might not even over the course of their whole life. So a lot of people will uncover um, pockets of what might help them,
Okay.
whether it's a relapse plan, whether it's kind of putting together their social system, to help them, or the accountability, things like that. So to me, those are extremely basic. And then some people might access, better help uncovering what's going on for them. But not very many people really explore and master, exactly what's going on in them emotionally and psychologically. So what the program does is it helps people to go through in their own privacy, in their own way, um, take on a whole series of concepts. And these concepts are all woven together from a bunch of different profound disciplines of psychology. And you come out of it totally understanding how you work. And so the people that go through it and understand how they work are not just then in control of their drinking or their drug use. They're just in better mastery of their whole psychological experience in life, how they're meeting relationships, whether or not their ambitions are healthy, how far out of their way they go to please people. If they do, well, where did that come from? Is that okay? To what extent do I do that? These are just small examples of, you explore all these things so you just really know yourself. And so you can imagine by the end, there's really just no surprises you get anymore.
Yeah.
It's not
Right.
just, okay, you avoid a surprise of a trigger. Even if you're triggered, even if you've got, adversity, even if you've got things that piss you off, scare you,
Right.
you understand how you work. And so the program is quite deep. It has the basic things in there as well, but it's meant to take people on a very deep psychological journey.
Okay. Got it. Yeah, that makes a lot of sense. Kind of like you said, just digging a little deeper and figuring out, to put it really simply, exactly what's going on. And
Mhm.
so the next time that these problems, if you will, pop up, you can deal with them a little bit better.
That's
And
right.
yeah, that sounds like that wouldn't just help with the addiction side of things, but I think in my mind that would just lead to a healthier and probably more successful life, a happier life overall.
Absolutely.
So, what kinds of people use self recovery, and who would you say this is really best suited for?
Uh, very fortunately, it's a nice convergence for different kinds of people. So in the program, um, I built it and started discovering as I was testing it, as I was sort of getting some beta users and things like that, that people were finding it for very different reasons.
Hmm.
So for one, it's less than 1% the cost of rehab. So some people do just enjoy that it's an actually affordable way of getting pretty darn complete help,
Hmm.
and arguably much better help. So one is just the cost alone, but also it's fully online and on demand. So there are people that come to it because they just can't take the time out of their life, to do more intensive treatment, but they
Got it.
know they need something much fuller than
Okay.
just reading some books or just going to the odd support group. Um, So that includes, maybe a business executive that's too busy, but it also includes, I've got a lot of, like single mothers who are, working, watching kids, and they just, couldn't imagine getting away. And this is the first thing, first real shot they have at doing a fuller program, because you can do it, really at any time, right? Whether that's in the middle of the day, at the end of the day, on the weekends, whatever it is. So so the fact that it's on demand and online really opens things up for anyone. We're now, on, a good amount of the globe. So, we've got people in countries that you forget exist, and so got, when the first person in Ghana, subscribed and enrolled, just it was this reminder, there's people in these corners of the globe that don't have good access to care. Um, and now they do, right? I mean, it's the couple clicks of a button, and someone in Ghana can now be in a very complete science-based psychological program.
Yeah.
So that as well. And then it's also for people that have been through that. A lot of people find it after they've relapsed and gone through a bunch of different programs.
Okay.
And as you might know, a lot of what exists is going to be 12-step.
Yeah.
And the program is not 12-step. It's going to be complementary to that sort of thing. So
Okay.
so for people that have already tried, one or two kinds of approaches, most of what exists is going to be 12-step, or if you're getting therapy, it's going to be cognitive behavioral therapy, CBT. And so a lot of people just have really never been exposed to other methodologies, other approaches, and they just really haven't ever been exposed to different kinds of treatments, whether that's through an organization, groups, a therapist, or whatever the vehicle would be for a different kind of method. They just haven't gotten that, and so they really are looking for something that's new, different, gives fuller context, maybe, for how they suffer. So
Okay.
yeah, and there's more as well, but yeah, rural kinds of environments where people just don't have access. So it's used by all kinds of different scenarios, different kinds of people.
That's great. That's great. Now you just touched on something, and look, this isn't to bash 12-step programs in any way, in part because, like I mentioned to you before we hopped on, I'm in one.
Hmm.
That's been my path of recovery, along with other things and some of the things you're mentioning. And I've always been told how important it is to keep an open mind, right? So that not only I can possibly improve my recovery, but really, I think, improve my life. I think any of us that are kind of closed-minded and looking at things from one perspective are really just limiting ourselves, right? So
Hmm.
I do want to ask, because I'm always curious to hear about these things. Um, I personally think that even people in a 12-step program should be doing other things if they need it, seeking therapy. I'm a health and fitness coach. I think that needs to be part of, anyone's treatment program. What are some of the parts or things in 12-step programs that you see as maybe not so helpful, or possibly even detrimental to someone's ability to get sober, to recover from addiction?
Yeah, well, before even looking at any particular things about it, you're
Sure.
actually already talking about, maybe the biggest problem I see with it, which is that, people are led to believe, it is the way,
Okay.
the only way.
The only way, right?
And so it is limiting then, right? For however much you commit or dedicate, to one method of any kind, right?
Mhm.
Also in your fitness, that's 1 minute you're doing that, and it's 1 minute you're not doing something else.
Something
That,
else, yeah.
that so when you're working out hard, and I don't know, exactly what your regimen is, you look very strong, and so I'm sure a very strength based one.
There's some lifting in there, a little
Yeah.
bit.
So you know you you probably that people who get really heavy into lifting might not be very good at flexibility and different sorts of training that open your body up. So a lot of people that work out a lot have, rounded kind of closed postures and don't really tend to that stuff. And so yeah, a lot of life is about, not becoming, too narrow in our approaches. So that's probably actually the biggest problem I see, is that people ask around, they have an addiction, they're wondering if they are something like that, and they get slowly exposed to, different, organizations, different places, different people they could see, and most of it's going to be 12-step based. Um, and so it's not really that I'm opposed to 12-step or anything, but um, the same thing would happen in therapy. If you're just only accessing CBT, well, that's a very logic-based form of therapy. You're going to really miss out on a lot of how emotions really work, which is not logic-based at all.
Yeah.
So yeah, the biggest problem would be just that people, follow that trail, and then unfortunately, the culture in 12-step can, then only reinforce the idea that that's really the best or the only way. And so I get a lot of patients who come to me, not necessarily because 12 steps was bad or they don't like it or anything, but
Right.
just because they understood there's more to look for, or they felt like when they were showing up at those meetings, like people were dissuading them, from
Mm,
considering anything else. So they would
mm,
dissuade therapy that was, in the mental health realm, and not by like an LCDC, or they would dissuade, being on a simple antidepressant,
yeah.
you know, and just sort of discount or dissuade them from doing other things
Mm,
that
mm-hmm.
are not necessarily bad for you. Um, just as I wouldn't necessarily dissuade someone from going to a 12-step meeting and getting this important camaraderie there, I'd hope that, it goes the other direction too.
That makes
That if
sense.
you need, good therapy, that you're not dissuaded from doing that. And there's pockets, right? It depends where you are in the country. I know we're both, here in the South. It tends to be a little worse in that regard in the South.
Mm,
But yeah, a lot of patients are quite upset about how, they won't be allowed, in a sober living environment that's 12-step based, if they're, getting mental health treatment and getting,
wow.
even just Prozac, right? So
Jeez. Yeah.
um, so things like that really turn people off. So yeah, I don't like when, anyone's told that they've got to only do one thing.
Hmm. Yeah.
Um,
That's a really great point. You've made some good points. And I'll say, look, on the flip side, just like there are, you know, I hate to just frame it as good and bad, but you know, I will, you know,
mhm.
good therapists and maybe
Oh, sure, sure.
you know, not so great therapists. There's a lot of 12-step groups out there,
Yeah.
and everyone's different, right? And I've been to meetings that I'm like, or groups where it's like you hear some of this kind of, I'm just going to kind of call it old school thinking around you know, getting help for mental health issues or
Mhm.
taking medication or, you know, I mean, I'll just say like some of the meetings that I frequent, like there are just like individuals that talk about that thing, but that's not the overall
Mhm.
thinking for sure. So I think that's part of it too. And I can see how, you know, someone new might come into a meeting and they might hear something from one individual and that really frames, or this one group is saying something and that kind of frames their whole you know, their whole thinking. You know, I do want to rewind here and go back to, we were kind of talking about labels earlier, and this
Mhm.
is one of the things that I think about you know, with the 12-step stuff, which I kind of go back and forth on, you know, and I'm curious what your thoughts are. I know I looked at your website and was kind of talking about some of the shaming that goes on, you know, in 12-step programs sometimes, and I don't know if you're saying this, but I know that from my own thinking and from what people you know, other people might think, or sometimes the way it's perceived, is this kind of constant shaming forever and this label
Mhm.
of I'm an addict,
Right.
I'm an alcoholic. Like, even though I'm in recovery, like this is still
Yeah.
me. And I think about that, you know, some of the outside 12-step stuff that I'm into kind of tells me like, hey, maybe that's keeping this label forever isn't the best thing. Although in
Yeah.
meetings, I will, I'll identify as an alcoholic or an addict.
Yeah.
Talk to me about that a little bit, and just the labeling and kind of the shame that maybe goes on that maybe isn't so helpful.
Yeah, well, yeah, what you're speaking to, is along the lines of something, I'd agree is to, should at the very least just give someone some pause. I mean, I'm glad that you're thinking about that. So, um, and that's generally just what's going to be helpful, for a person is just to at least be able to openly question things, so that even if you decide, well, I want to introduce myself as an alcoholic, and we're just talking about even just at the meeting, not
Sure,
necessarily
sure.
out in public. um, it should be allowed that you just question, is this good for us guys,
Mm-hmm,
and that
mm-hmm.
people calmly respond to that, and not just shame you and make you feel like, well, then you're in denial, if you
Right.
don't want to say, you know hi, you know I'm Jonathan and I'm an alcoholic. It's there's no science that tells us it's good to identify with illness. It's quite the contrary.
Mm-hmm.
Generally, people do well when they don't identify as ill. Is it true that people will have a lifelong battle with their drug of choice, their alcohol, with whatever it is that gets them? Yeah, yeah, and we don't even have to get into whether there's a whole lot of science around whether you really have this biological illness for life or not. But even leaving that alone, even if we say 100% we're sure you have this illness your whole life, it's still a question of whether you should be identifying as that. It's
Mm-hmm.
one thing. I think anyone has to get the idea that part of it's having this humility, right? To say, okay, wait, I have to always be careful. I'm an alcoholic. I need to always treat myself like I could relapse and I've got this temptation. So there's a part that's just always serving as this mindful reminder that you've got this part of you that you need to be really careful with.
Mm-hmm.
Um, but there's a difference between that and actually identifying as that on a very regular basis.
Mm-hmm.
So if you were, let's take your realm too, let's say you're working with someone who is very overweight, and then they work out with you, you do a good job with them, and they're a good healthy weight now. You wouldn't want them to introduce themselves even in a group, um, that's for overweight people. I wouldn't necessarily recommend to that group that they start out by introducing themselves as, hi, I'm Jim, I'm overweight, and then here's my story of how I lost weight and
Mm-hmm.
I'm healthier now.
Yeah.
You would say, no, you were overweight, or you have a tendency to overeat
Mm-hmm.
or binge eat, or you going back to again these labels, and that's how you're bringing it up, which is I think the right framework to use. Is it appropriate to be using a label that often and forever?
Mm-hmm.
It's just a good question. I mean, you're it's fine to, you can, but you have to understand there isn't, you know, that's not for everyone. A lot of people want to be able to work through that.
Mm-hmm. Mm-hmm.
Should you at some times have the humility and respect for how quickly things can turn, and remind yourself that it can go there? Sure, sure. But to do it regularly and forever, that's the part that could certainly be questioned. So
Yeah.
we could play this game with anything, right? I mean,
Sure,
if you've
sure.
been depressed before, or if you've been a really angry person, I wouldn't command that person to always introduce themselves, even in a private circle, as I wouldn't say, hi, I'm Daniel, I'm angry. I'm an
Mm-hmm.
angry person.
Mm-hmm. Mm-hmm. Yeah.
I'd
I
want to remember that I can get angry,
Right, right.
but that's a different thing.
Yeah, yeah. And see, look, I honestly, I think it's important to have these conversations, I mean, um, even one of the like recovery related meditations I was reading the other day talks about the importance of asking questions.
Hmm.
And again, I think these are conversations that should be able, it's not a debate, right? It's a conversation. It's again having an open mind about things. And so yeah, I'm thinking about this, and just my own journey with this identification, and we'll just call it a label, right?
Hmm.
And so for me, this is what it looks like, and in part why what you're saying makes sense, and I can personally relate to it, is because initially coming into a 12-step program, it was I'm Jonathan, I'm an alcoholic or an addict, and man, I just need help right now. Like I am
Yeah.
recognizing that this is a problem,
Yeah.
and now that I've been around for a few years, I identify as that in meetings. For me personally, I think in part just like, I don't know if respect is the right word, but I'm just going to say like out of respect for like the program, right?
Uh-huh.
And for me now, what goes through my mind, and I think what you're saying is that this is like an important part of the internal conversation,
Hmm.
is I'm Jonathan, I'm an alcoholic or an addict. Um, and I'm identifying as being part of this group. And I'm
Yeah.
saying to myself, I'm part of this group. I'm one of you guys, but that's not me anymore. Like
Yeah.
that's who I used to be. Like that's the conversation in my own head. Yes, I need to be like I'm here
Yeah.
because I need to continue to treat this. This is what has worked for me. But I'm not that person I was anymore. And I'm a big uh, believer in limiting beliefs too,
Uh-huh. Uh-huh.
and how these labels can hold us back. It's kind of like within a 12-step program, one thing I've seen, a label I've seen probably work against people, is someone that comes in for a long time and they'll introduce themselves almost right off the bat as a chronic relapser,
Uh-huh.
right? And it's like, so what does that
Yeah.
chronic relapser do, right? They chronically,
Right.
relapse, and so I can definitely see both sides of this, and again, before we even hopped on, I told you I was definitely someone that initially in my early years of sobriety and being in a 12-step program, I was like, man, this is the only way, and I think my thinking has changed on that. But no matter what someone thinks, I think again, it's about having an open mind, right? And being
Yeah.
able to explore different things and figure out what works for you.
Yeah. Exactly. Yeah, and that's why the first, biggest problem I have is just, when anyone is ever too rigid. Um, yeah, and things go both ways too, right? So we're talking about the harms and, the limiting nature sometimes of identifying, forever as ill. But you also have people in those groups who sort of profess to know, and have all the answers,
Mm-hmm.
and maybe they're they have been relapsing and they don't tell you, right? That happens all the
Mm-hmm.
time.
Mm-hmm.
But let's actually assume that they're actually completely in recovery and they're being honest about that.
Right.
um, just because you've been in recovery and been perfect about it for, let's say, 20 years, it doesn't mean that you necessarily have the answers or that you're healthy.
Mm.
So, I see people all the time who are, they've tried to convince themselves that they are.
Mm-hmm.
And, I'll often, see them still just hurting themselves in all kinds of ways.
Mm-hmm.
So, um, and we could run through a million examples, but I
Sure.
mean, let's
Sure.
just draw up a scenario where, someone's, completely abstinent, but they're just awful in their relationships. Maybe they are mean, maybe they're selfish. You got people in groups. So it comes back to then just also another point, that people need to be careful about always is you don't know, like you said, who's stepping up in the group and framing it in a certain way, which
Mm-hmm.
ones are the loud ones, the quiet ones. And so I can't tell you how many patients I have who stop going because they don't like being spoken down to by people that
Mm.
just kind of take charge and
Mm-hmm.
don't necessarily have the answers, but claim to. There's people they know will be lying. They'll know their buddy or someone has been using, and then they show up and say they're not, right? and that sort of just undermines the spirit of the group.
Mhm.
And like we said, about different views on mental health or being on a medication, people will show up and they'll be cheating on, a spouse with someone in the group.
Mm.
And so you can see with this, it's actually, none of those have much to do with 12-step
Right,
itself,
right.
right? It's
Yeah.
just the members that show up. But what is sort of a 12-step thing is that it's not really governed, and there's no uh, real facilitator, right?
Right.
You're not getting sort of a qualified facilitator, which is good and bad, right? I mean,
Mhm.
I do
Yeah.
want to be in groups in my life that aren't so, you know, professional and facilitator led and stuff like that.
Mhm.
There's a time and place for that, and then there's also a time and place for, real professional sorts of, certifications needed, and so on. um, and you'd want generally, some mix of both.
Yeah.
you know People who see you, you have a credential and you're able to help people in their fitness. But yeah, you can also then ask your buddy, well, what do you eat post workout? And you're allowed to get a little of both. It's, my patients shouldn't only get better based on, what I do with them. They should also get informal benefit from
Mm.
self-help books or what their Aunt Margie told them.
Right.
And
Right.
that's okay. But yeah, and it goes back to the biggest premise that's a problem is when you think it's the only outlet, the only group, the only method. Well, then you have a problem if you're showing up, and then um, people will relapse when they encounter the bad actors in the group,
Mm.
because they kind of throw in the towel when they see that the leader they had really believed in, isn't this authentic leader they thought they were.
Yeah.
Stuff like that.
Yeah, yeah, for sure. Yeah, and part of what I hear you saying, and what I'm so glad was pointed out to me early on, is, well, if we just go back to the like checking off the boxes, right? Everyone's different, and look, people are human too. There are going to be people that make certain decisions. They're gonna be crappy people everywhere,
Mhm.
you know,
Yeah.
and they're just those people. But you mentioned like someone that might go into a group and they don't really like they get the feeling that people are talking down to them. I had that experience at one point when I was first introduced to, when I basically what it really was, it didn't matter where I went. I wasn't where I went, I wasn't ready to get sober. Was
Yeah.
for me personally. It didn't matter what I did. But when I went back, I was in such need of help that I really appreciated people being direct with me.
Hmm.
And that may not, that type of conversation may not be helpful to people. It needs to be done in the right way too.
Hmm.
And let's be real, like I said, there are even my friends within 12-step groups will acknowledge there are sick groups out there,
Hmm.
as I think how most people would refer to it. So again, not trying to bash. I think it's important to be, just like when someone goes into a 12-step program, have to be open-minded, right? And I think what you've said in terms of, hey, there shouldn't just be one way. We shouldn't just be looking at anything as just like this is the only way. I think that's the point here. So I really appreciate you giving some of your input, because I think you've made some good points for sure. Now, as I read through your website, you point out, some of the flaws, so to speak, in current treatment models, and maybe what some facilities or professionals are doing. Could you briefly just touch on a couple of those? Just some of the. I don't think there's any secret, right? Like
Hmm.
there are some problems in the treatment industry, if we want to call it that. What are some of the main ones that you see?
Really, a lot of it stems from just the profit motive, that you get
Mm,
in any high-paying industry.
yeah, yeah.
Um, yeah, and you can, trace that and see, all kinds of problems in the world, stem from that. So things are slowly improving, I should say. I'm pleasantly surprised by the year that, year by year, we do see improvements and better cracking down on this. But I mean, I don't know if the audience is aware that, there are a lot of uh, very, very illegal activities going on, in the rehab industry. So just to kind of name a handful, but the list is large. Rehabs will of course be incentivized to get people in the door, right? It's a very high paying thing. So sometimes it's cash pay. Most of the time, it's going to be through insurance, uh, and so historically they've done kind of whatever they can to get they call heads in beds, and you wouldn't believe the kinds of conversations and emails and meetings that go on. I've consulted and worked at several rehabs. So
Yeah,
so
and
I
if I could just pause just to fill people in, I mean, some of
yeah.
the stuff that's going on and some of the stuff I've heard about and has come out more recently is just like people even offering people that are struggling drugs and money and cigarettes to come to their treatment centers so that the treatment center can charge their insurance essentially, right? So
Oh yeah.
crazy stuff like that.
Yeah, there'll be just this poaching going on. People will show up even at 12-step meetings, trying to kind of find people to
Hmm.
get admitted.
Yeah.
So yeah, they will lie about the presentation or that person's scenario to the insurance, to get them admitted.
Hmm.
The patients can sometimes, not can legally, but they will sometimes be paid by the rehab to be admitted. And you say, well, why are they going to pay the patient? Because they're going to pay the patient a little bit and they're going to collect a huge amount from the
Hmm.
insurance.
Hmm.
So, the patient who's maybe, going through a hell of a time is happy to be at a rehab for a little while, especially if they're getting paid.
Yeah.
And so, those are some of the worst cases. It's illegal, but, rehabs are paying kickbacks to people that go and find, people to get into rehab. And when you have a profit incentive to do that, you wouldn't believe the kinds of things people do, to get people in the door.
Mm.
Um, Also, then it becomes, a little bit toxic when you've got a couple of those people, say, 2 out of the 20 at the rehab are there for just kind of bad reasons. It just kills the group. It
Mm.
kills the atmosphere.
That makes sense. Yeah.
Um, but yeah, so there's that. There's the fact that a lot of people go at a time they're really not interested and ready for it, but there's been an intervention, and
Right.
so
Or
rather than
family or
yeah,
hmm
sometimes people turn that around and they make the best of it. Often they do not, and again, then they're kind of spoiling the atmosphere in the group for the people that are there, for good reasons. Um, and yeah, a lot of the times there's just no question around, does this person need this level of care or would they be okay in an IOP,
yeah,
which,
right.
is like an intensive outpatient program where you'd
Hmm.
go for many hours per week, or you're still going home. So, some people absolutely need rehab. They're very legitimate. The rehab's legitimate, and they're there because life is just very dangerous. They're at a very risky period of time in their use, and they really do need to be somewhere outside of their regular environment. Um, so that I hope it goes without saying. Rehab, 12-step, everything, often has a very, very good place. But we're talking about, you know, still there's a good percent of the time it's not going as planned or ideally. So yeah, then you get in the door of the rehab, and first of all, it's quite expensive. Remember, I mean, you're paying
Sure, sure.
for real estate, you're paying for the food, you're paying
Hmm.
for the hospitality,
Hmm.
and all the extra admin. So you'll ask someone often, what did you really do in there? Like what actually happened, over that month or 3 months, and they've had maybe, in a month about 4 or 5 hours of individual therapy.
Hmm.
Well, they could have had that in half a day as an outpatient
Hmm.
somewhere. Um, or they attended groups. What did you get in the groups? Well, we were watching these videos. We talked about this. Well, could you have done that, for $10 a group, somewhere else in your city? Could you have watched those videos? Could there be a curriculum or something you could have worked through on your own? Now, does it help to have all that extra accountability and the group and everything? Yeah, again, for some people, that's the absolute best thing, and they need that. But a lot of the times, like I said, it's not questioned. It's just, rehab's good. If you have the money, go. And there's not really much question as to whether they need that level of care. But yeah, if you go get that level of care, you sure as hell want the best level of care. You should be getting more than 1 hour of therapy individually a week, and seen by a psychiatrist as well.
Yeah.
So, a lot of times you just go and the atmosphere isn't so good. There's people who don't want to be there. There's not that individual attention, and so if you're in a handful of groups a day, well then again ask yourself, could you get those in other ways?
Hmm.
And then yeah, there's other things. There's they'll collect urines and things like that to just run up your insurance bill
Yeah.
when there's really no need for it. They'll try to convince you to stay for much longer than might be necessary. So all sorts of things.
Yeah. Got it. Yeah. So, and so I just want to look at the flip side of this and not, not to just look at the exact opposite of what you've just said about, cost and everything. But if there were just maybe a couple of main changes, if you could say, okay, like here's what we're going to start doing tomorrow, to kind of fix all of this up,
Hmm.
and really, again, like this is all about making the success rate better, right? I mean
Yeah.
that should be the real goal. And I mean, look, like it is a business at the same time. Like it does suck to just be honest about the profit motive is there in the sense
Hmm.
that when these people relapse, some places almost want that because then they can make more money, right?
Hmm.
So what are some of the changes that you would put in place, or do you think need to be made to really allow this success rate to go up?
I think being very clear up front about exactly what's being offered, not just vague language about,
Okay.
that you're going to recover and you'll heal and some magical place, but,
Hmm.
really being specific. So, um, showing them what the curriculum is, what kinds of concepts they're going to be introduced to, what are the actual therapeutic modalities, um, and get into the details so you know what you're getting before, because can't tell you how many people show up and they were told it's going to be a private room. They were told it's going to be, healthy meals, but it's sloppy joes. And they were
Right,
told,
right.
they're going to get individual attention, but it
Hmm.
was 4 hours over the whole month and all that stuff. So a lot of the times it's just that kind of, you know, not outright trickery, but just sort of the vague, they were on the admissions call and it just kind of got a lot of yeses, and then the intervention, was there, and it just all forces are just kind of, pulling to, just go, because you don't want to look like you're questioning everything, right?
Hmm.
Everybody's upset that you've been, drinking yourself silly. And so no one's really got the patience for you to start questioning, well, is this place okay? What's the curriculum? So the forces, are kind of against you there. But yeah, being transparent, also being very transparent about success rates. So places will not have proper data collection, so that's a big problem, right? And we are going through this in just the hospital system at large in the medical field. So I'd say that the same standard needs to be held there, where, we say, okay, this surgical center at the hospital, what is the rate of success?
Right.
How many of these patients have to get readmitted after they
Hmm.
had a heart attack,
Hmm.
stuff like
Hmm.
that. So we've got that data in the medical field. We need to treat, addiction more medically in that way. Yeah, there's a spirituality component and stuff like that. So there's parts that aren't strictly medical,
Sure.
but as far as treating it professionally and keeping legitimacy, you've got to be able to show data. So places will, for example, for every 100 that are discharged, they'll get a hold of less than half of them, and then the ones who do answer the phone, often don't want to go back. So they're asked on this follow-up, are you sober now? And they just say yes and want to get off the phone. Or they're people pleasers, and that part maybe wasn't ever addressed. And so
Right.
they're
Yeah.
still trying to please you. They're so grateful for their time, and they don't want to say, that they're not doing well. So, in medicine, that would absolutely never go over. We have peer-reviewed journal articles, not just like white papers. And we study things rigorously, and they're examined by medical boards. The whatever the surveys are going to be have to be approved, and how it's collected. You don't just do it over the phone. You would get drug tests and things like that, to verify it. Um, but where I'm going with this is that they'll claim a relapse rate of only whatever, let's say 5%, but in actuality, it could be over 60%, over 80%,
Mm.
and you just don't know.
Yeah.
um, so yeah, better clarity upfront, better clarity on what the results are and what the actual modalities being used are, and then more individual attention. So yes, it's a good group model. I fully believe in the power of groups, and I've incorporated that into self-recovery. Groups do a lot of things that individual treatment cannot. But to do 95% group when you're paying that kind of price to go in for that level of care, you should probably get a little more individual time. You should be treated individually every day, not just briefly once a week. So
Okay.
the better treatment centers do that, but that's not most of them.
Yeah. Hmm. All great points. And yeah, I think about that success rate a lot because I remember after I went to treatment getting that phone call and thinking, how many people just lie
Oh
or
yeah.
just don't answer the phone, and so how accurate is this number that that this treatment center is or any treatment center is putting out about their 80, 90, whatever high percent success rate. So
Yeah.
those are all great suggestions. Daniel, I want to ask before we wrap up if maybe there's one piece of advice that you'd like to share with the sober nation, whether it's for someone that is struggling, someone that's new in recovery, someone that's trying to find their way, or maybe someone that's been around for a while and just having a tough time.
Yeah, I mean, maybe to just put a different spin on, I feel like maybe we're talking about the bad parts of labeling, the bad parts of 12-step, the bad parts of rehab. And I'm a very strong supporter of all those things, when they're done, with good intentions and honestly, and, and done with good skill. So I like all that. And, I think the biggest message would be just no matter how you're trying to improve yourself, that you cut through all the different labels, you cut through who's helping you, or what that approach is, and that ultimately you should be very focused on taking care of what is actually causing your suffering. So really getting to the underlying nature of how you suffer. And if you do that, you're going to always be spending your time and energy really well and really efficiently, and get a huge amount of gain out of that. So, not to get too caught up in that label, not to get too caught up with, should I go to this person or that rehab or that organization? But, just no matter what it is, if it's being done well, you should be getting to underlying issues. And you had mentioned earlier too, there's a lot of bad therapists too. There's a lot of bad psychiatrists.
Mm-hmm, mm-hmm.
So, whatever it is, and that you're doing, um, and even just self-help books, whatever you're doing to try and improve yourself, make sure you are giving, almost all of your attention on the underlying nature of your suffering. And if you do that, you're good.
Wow, that's really great advice. So you can learn more about Daniel and the Self Recovery Program by visiting selfrecovery.org. Thanks again for coming on the show, Daniel.
So happy to be here. Thanks for having me.
Be sure to check out the show notes for all the info from today's episode. Sober Nation FM is brought to you by Sobriety Engine. Sobriety Engine is a free online community of men and women supporting each other in their recovery. Visit sobrietyengine.com to join today. This show is also brought to you by Recover Health. If you're ready to get fit and start living a healthier lifestyle while supporting your sobriety, you can learn more about having me as your own personal fitness and nutrition coach at rcvrhealth.com. And again, whether you're listening to the show on Spotify, Apple Podcasts, or watching on YouTube, please share this with your friends, follow, subscribe, and leave us a review. Nation, thanks for tuning in, and I'll see you next time.